us on this momentous day where the first COVID-19 vaccinations were given to Quad Cityans. Today we have Ed Rivers of the Scott County Health Department and Nita Ludwig of the Rock Island County Health Department will give you a little bit more information about the COVID-19 vaccine. As always, they will have talking points and then we'll take questions at the end. If you have any questions, please put them in the chat box and we will answer them to the best of our ability. First of all, Nita, let's start with Rock Island County numbers.
Thank you, Janet. Rock Island County today is reporting additional 6 deaths from COVID-19 in our county. And that was a man in his 80s and a man in his 70s, both of whom had been hospitalized, a woman over the age of 100, 2 women in their 80s, and a woman in her 70s, all of whom were in long-term care facilities. The total number of deaths in our county is now 205. And that is a very grim milestone with more than 200 deaths in Rock Island County that we've crossed today. Just for some context, we have from April until October 25th, the health department recorded 100 COVID-19 deaths. And since October 26th, we've lost 105 Rock Island County residents to this virus. And we certainly offer our deepest sympathies to the families and friends of those who passed away this week and also to anyone who has lost a loved one during this pandemic. Our total now in Rock Island County of cases is 9,839, which includes the 56 new cases in Rock Island County today. And we currently have 58 people hospitalized in Rock Island County with COVID-19.
In Scott County, the Iowa Department of Public Health reports 13,004 cases, and our deaths are 120. The first doses of the Pfizer COVID-19 vaccine will be making their way into our community this week. We're on the verge of the biggest public health response in modern history. We're going to ask for your patience and understanding as the vaccination campaign gets underway. Both health departments have received many requests to register for the COVID-19 vaccine or describe the vital role their organization plays in our community. At this time, there is no list to join. We recognize that all sectors are vital to the health and prosperity of our community. However, the decisions regarding the order in which groups will get access to the vaccine are being made primarily at the federal and state levels. Healthcare workers, long-term care residents, and long-term care staff have been identified as the first groups to get the vaccine based on the recommendations from the Centers for Disease Control's Advisory Committee on Immunization Practices. The state of Iowa has created an advisory group that will provide additional guidance on immunizing healthcare workers in this initial phase. The state of Illinois is planning to provide additional guidance as well. At this point, we as partners are finalizing our phase 1A plans for how and where the first priority groups will receive vaccine. Next, we will determine procedures for other priority groups, such as essential workers. We expect more guidance from our state and federal partners about who comes next, but it will take a while to get through phase 1A. The initial quantities of the vaccine to be delivered are small.
Although we don't have a set timeline, everyone in our community will be able to get access to the COVID-19 vaccine in time. Your turn will come, and in the meantime, you should learn about the vaccine and get any answers to any questions you may have. Please use credible resources or talk to your healthcare provider. Even though vaccine is becoming available, we still have to keep using public health measures to prevent the spread. The virus is still circulating in our community. Keep wearing a mask, social distance when you're in public, and wash your hands often. And of course, stay home when you're sick. For those making plans for upcoming holidays, we ask that you heed our guidance so that you can choose low-risk ways to enjoy your holiday. Spend the upcoming holidays only with members of your own household. Including individuals from other households to your holiday celebrations seriously increases the risk of spreading the virus around the table. Staying home is the best way to protect yourself and others from COVID-19. Avoid travel as much as possible. If you do make a decision to host or attend holiday gatherings, keep them small. The Quad City resident expert, Dr. Louis Katz, believes groups larger than 10 significantly increase the risk of spreading the virus. The COVID-19 vaccine is a hopeful development in what has been a very dark 10 months. However, we must still work together to control the spread of the virus until the vaccine is available to all members of our community. Thank you.
Thank you, Ed and Nita. I appreciate those words. We are now, we'll be able to take questions. Please type them into the chat box. Okay, let's start with this. Does the health department have any say in who is considered essential for the next round? Nita, let's start with you.
Sure. For those groups, it will be the Advisory Committee on Immunization Practices that the state of Illinois will be going with for the definitions of the critical infrastructure or essential workers. We do know that typically those have included transportation, government, grocery store workers, those types of workers. But until the ACIP gives us further guidance, we don't have a clear definition at this point.
Ed, what do you know about Iowa's practices?
Well, the states, Iowa among them, follow the federal recommendations from the CDC. So I don't expect to see any difference in the definition of essential workers. Other than that, the Advisory Committee for Immunization Practices has already recommended.
Okay, thank you. The Moderna vaccine is expected to be approved soon. Do we have any idea when it could arrive in the Quad Cities? Ed?
Well, presuming that the ACIP hearing tomorrow moves forward and the EUA, the emergency use application is approved, the plan is for it to be shipped on October 21st. It should arrive in the state shortly thereafter and then be distributed to locals.
Nita, what do we know about Illinois' plans for this vaccine?
Sure. Well, just like Ed alluded to, as soon as it has an emergency use authorization, we have heard from our state partners that it will be shipped as well in Illinois. So Pfizer, of course, is the first one that's approved, and that will be shipping this week. I know Iowa has already started, so that's great. And then we do expect Moderna to be following soon after.
Okay, so we do know that there are some differences between those vaccines, including the cold storage and shipping. What other differences do we know about this, and will people have a choice as to which vaccine that they get? Let's start with Nita.
Sure. Well, I think the guidance has been to take whichever vaccine is available to you first. We do know that the Pfizer vaccine, the second dose is due after 21 days, and Moderna's, the second dose would be due after 28 days.
Ed, what guidance do we have regarding vaccination? If you start with Pfizer, do you need to continue with Pfizer, for example?
Yes, you will receive the same vaccine for your second dose that you received for your first dose. The types, the brands cannot be mixed.
What are the ways that we will make sure that people come back for their second doses, Ed?
Well, the appointment for your second dose will be made during your visit for the first dose. The immunity that's conferred with only one dose has not been studied. So it's very important that people come back for the second dose and having their contact information. I'm certain there'll be outreach efforts to those who fail to show up for that second appointment.
You know, what could you add for Illinois' plan for that?
Sure. Well, we've been discussing, there are a couple of smartphone applications that you can use. There's one from the CDC. It's free. It's called Be Safe. And a person can choose to put that into their phone. They'll record their information on their first vaccine, and then it will give you reminders for when that second dose is due. Illinois is also planning to employ another different kind of app in January, and that will be available basically when we get ready to have vaccination available for the general public. And it can track your lot number, when you received it, where you received it, and then also give you information on where and how to get that second dose.
So even when people are vaccinated, we are still recommending that they follow the public health guidance. Why is that, Ed?
No vaccine is 100% effective. The indication is that both these vaccines are about 95% effective, which means that of 100 people who take it and are exposed to a disease, 5 will develop it. So it's still important to employ those public health measures that we all have been doing. And also there is individual variants that I may have a less robust reaction to the vaccine than you, and I may get it where you may not. So we both need to continue those public health practices to which we become accustomed.
You know, what should employers know about the vaccine, especially the second dose, as far as the reaction goes for people who will be taking it?
Sure. Well, there definitely is more information to come, but right now it does appear that if people take their second dose, they may be likely to be not feeling well the next day. They could have a slight fever, some fatigue, that sort of thing. So it is important for employers to note not to get all their employees vaccinated on the same day, or they might be short-staffed, and to make sure that they kind of allow for people, they might need to not be at work that day after their second dose.
It's important to note, though, that the vaccine is not giving people COVID. It's just the body's really strong immune response, which is exactly what we want. Ed, do we have any guidance on whether this will become a yearly vaccine yet?
Well, we've had no long-term studies at this point. We've only had 2 or 3 months of experience with it. Given that the body's immune response to the virus itself wanes after a period, it may be that you may have to take it yearly.
Okay, that is the end of the questions that have already been typed into the chat box. Let's pause here for a little bit to see if any other questions come in, and otherwise we will end for today and expect to come to you on Thursday. All right, I see no other questions. We appreciate your time. Please continue to watch our Facebook pages, Together QC, and our respective health department pages for the most up-to-date information. Thank you so much. Bye.